In recent years, advancements in cancer treatments have improved the effectiveness of radiation therapy specifically, and one of the most promising developments has been marker-free radiation. So Gabrielle Pfeiffer recently visited with Mount Carmel Health System, the first in Central Ohio to offer this type of procedure. We're learning how it works in this sponsored segment.
Dr. Yaney, it is so nice to meet you. Thanks for having me here to talk about this.
Pleasure to be here today.
Yes, so this markerless radiation treatment, I'm sure, is really welcome news for a lot of cancer patients. Can you really just explain what that is and how is it different from those traditional methods that patients are really used to?
One of the things that's always been really important for radiation treatments is ensuring proper patient setup. So traditionally, the setup has been done with actual physical tattoos put on the patient, and they use those to align to certain lasers on the wall, and that's how treatment was done. And those traditional tattoos have a lot of downsides in terms of they're just like any other tattoo, so they're always there. They're kind of always a constant reminder of the patient's cancer journey 10, 20, 30 years down the road. Over time, things have developed, things have changed. Some institutions now have switched from the physical tattoos to doing just permanent like marker, but even that has a lot of downsides in terms of throughout the actual course of treatment, and the fact that, you know, they have to be careful when they're bathing, they have to be careful at the gym that they don't sweat the markers off, which again really makes them think even more about all of the things that they're going through. And so we're really excited to be the first in Central Ohio to offer this markerless setup. Basically everything is done technologically, so we have cameras that project a pattern onto the patient's body, and instead of just having a few tattoos or a few marks, it acts as thousands of virtual tattoos. And so it allows for really precise treatment, really precise setup, and importantly, psychosocially for the patients, they don't have to have that constant reminder of their treatment, whether it's current or 20, 30 years down the line.
Yeah, it's almost like a confidence booster. Like, I would assume that is just one of the benefits really of this particular treatment, right?
It allows the patients just to come in, get their treatments, and move on with their daily lives. They don't have to think about it. They just come in, and really it's just another thing that they do, and then they get to move on and be regular people.
Mm-hmm. And it's still effective without the markers too.
Yeah, and so actually it's more effective. So because of its thousands of virtual markings, it has sub-half millimeter accuracy. So we're talking very fine data, very fine setup. And so it's wonderful too, because we have technology that says if a patient moves, it actually shuts off the radiation machine, so that we're ensuring that what we want to treat is being treated, what we want to avoid is being avoided. And so that's a really great way to maximize treatment efficacy. So make sure the treatment is as effective as possible while minimizing side effects as much as possible, which is at the end of the day what radiation oncology should be all about.
Yeah, definitely really important. And what cancer patients are able to really, benefit from this treatment?
So it's actually very exciting. We've been able to implement this for all of our cancer patients.
Wow, that's amazing.
And so it doesn't matter if you have breast cancer, prostate cancer, cancer of the head and neck, lung cancer, all of the patients now more or less are being treated with this markerless setup, which is great. It gets treatments done faster, planning scans done faster, and again, like I said, just ensures that the accuracy is even better than what it was before.
Yeah, and as you mentioned, Mount Carmel Health System was the first to have this in Central Ohio. Which of your health systems, your hospitals, are providing this to patients?
So patients are able to receive markerless setup at here at Mount Carmel Grove City, at Mount Carmel East, and at Mount Carmel St. Anne. So all of the radiation facilities have the capability of doing this.
And Dr. Yaney, all people have to do is go to the website mountcarmelhealth.com/cancer, right? Just to get all of the information that they need.
That is correct.
Okay, thank you so much for talking to me about this.
Yeah, thank you for having me.